You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest, oral surgeon, says that nobody should be wearing a loose-fitting denture. He's an expert on the topic. In fact, he's North Carolina's go-to oral surgeon when you want a brand new set of teeth, supported by dental implants. With us, we have Dr. Din Lam. Dr. Lam, welcome to the program.
More than happy to be here, Randy.
Okay, good. Now, I know you brought a stack of photos,
Okay.
So we'll try to get to as many of those as possible. But for people that don't know your practice, like who's the typical dental implant patient?
So, Randy, there's basically two types of patients who come to see us. One is just that they have seen dentists all their life. They start to have failing terminal teeth, periodontal disease, bleeding gum. It's just that the teeth just becoming hopeless day by day kind of thing. The second type of patient who come to see us is the one that they've been wearing dentures for so long and like it doesn't fit, doesn't stay in their mouth. When they talk, the mouth is doing one thing, the denture is doing another thing, and they are always so subconscious about their dentures that falling out in the middle of the conversations.
So dental implant, at the top of the show, we said no more dentures. So do you believe this is like the future of dentistry? Like 20 years from now, dentures as we know them might be gone?
Absolutely. I mean, denture has been there for so long and it should be extinct by now. I mean, implant works so well. I mean, everyone should have implants in their mouth to hold on to their false teeth, dentures, because, I mean, it's a right to smile naturally. It's a right to able to eat what you want. Having a denture in your mouth just take away all the rights that you have. So, I mean, I almost think that everyone who needs a denture should have an implant to help to stabilize the dentures, have a natural smile so that they don't have to worry about their dentures in their mouth. So both of those patients who come to us, they just want a new set of teeth so that they can eat and talk normally.
Okay. Now, at your center, I guess how dental implants are typically done is you go to one place that they do the surgery, like the oral surgeon, that's you, and then you go to another place where they put the teeth on top, maybe somewhere else for the imaging. Now, you do both parts. I mean, you do it all right there, and you have your own lab. Is that correct? Is that why you do it so quickly?
Randy, that's correct. I mean, that's exactly how we want to do it. The reason we did it this way is because back in the day when I first started, I'm an oral surgeon, so I have refer patients to me. I'll do the surgery. They go back to the general dentist. They get the teeth, and then they have to come back and forth to the lab and all this stuff. It's just that it's a logistic nightmare for our patients.
A logistic nightmare.
It's not just a nightmare for patients because it sounds funny because it seems like no one's talked to each other. But now we have everything in one house. We talk to each other. We deliver the best result for our patients. Not the best result, ridiculously good result for our patients.
Okay.
I mean, it's just like mind-boggling that the results that we are able to provide the patients. And on top of that, it's easy for the patients. They don't have to go to one place or another place and then another place to get everything done. Everything is done in-house under the one roof.
Is this true? Okay, let's say if everything works out perfect. Like a 75-year-old that's pretty healthy, they could come in tomorrow and in 2 days after that have their upper and lower teeth that don't come out. Is that true? You can turn it around that fast?
We can turn it around even faster. We can even make it surgery in the morning, and then a few hours later, they will get their teeth on the bottom, on the top or on the bottom. It's just a matter of how fast the patients want it. We tell the patients, we can make it fast, but if you want good work, you want good result. Not good result, ridiculously good result. Give the lab a little bit more time so that go home, take it easy, relax. You just have surgery done for a couple hours. You come back later on in the afternoon, or you can come back the next day and we'll give you the teeth. Because the teeth we make, we don't make the teeth before the surgery, we make the teeth after the surgery. So it's custom to you where we put the implants in, how your gum looks like, so that the teeth only fit you. We don't retrofit anything.
Okay.
I mean, you probably know, most people know, Randy, that if you retrofit anything, it never work out that nicely. So we decided we don't want to retrofit anything. We want to make the teeth custom to the implant, custom to the gum, custom to the patients, so that when they come in, that teeth is for them. Only for them, not for anyone else.
Okay, good. Now, where you are in North Carolina, I mean, are there a lot of people in North Carolina wearing an upper or lower denture?
Absolutely. I mean, I see them every day. I mean, I always make a joke. we have a Bank of America stadium for our Carolina Panthers team. We can feel people who are about to get dentures or wearing dentures. We can feel that stadium 2 or 3 times.
Okay.
We see them every day.
So if it's so good, okay, so if getting new teeth supported by dental implants is so good, why aren't they all doing it? Why aren't all these denture wearers coming in? What's your take?
I mean, I wish I can tell you one factors, but most of the time it's multifactorial. But I would say, from my experience, always break down to 4 things that patients don't get this dental implant.
Okay.
Number 1, they don't know because they've been wearing dentures for so long. When they wear dentures, you don't see a dentist. You only see them like once in a blue moon because you may have to do some adjustments here and there. So they don't know what is available to them. Because maybe when they get the dentures, it was 20, 15 years ago, implant was not available to them. The dentists don't know about implant. The dentists did not know about what implant can do for people who wear dentures. So they did not know. They thought that's the best thing they can have, and that's what they go with. So they don't know.
That's number 1.
That's number 1. Number 2, the fear. Most of those guys who wear dentures, they have bad experience when they were younger, or they are when they have tooth pain, they have root canal done, they have crown and bridge, all this crazy stuff done in their mouth, and they're just so scared to go back to see a dentist.
So the last thing they want to do is see you, especially the oral surgeon. They know they're in trouble, right? When they see you. Do you ever hear that? No offense, doctor, but I don't like being here. I don't like the dentist.
But I'll tell my patients that, you know what? We can make them very comfortable because we can do sedation in our office. I even have my own board certified anesthesiologist in my office to help you, to sedate you, to make you feel comfortable. We walk you through the whole process, no surprises. So it's unlike any experience that patients had in the past. We want to make sure that when the patients come to us, they are comfortable with what they are getting. And during the process, we give them the best care. Not only we have me doing the surgery, but we also have a board certified medical anesthesiologist in the office to do the sedation, so that when everything is done, you are able to go home without any fear.
How old can you be to do this?
This is a fascinating question because every time I thought, you know what, this is 80-something years old patient that I just did the surgery a couple of weeks ago. It's the oldest that will be the oldest patients that I've seen. A couple of weeks later, I have another one that's older than that.
What's your oldest patient?
My oldest patient is 91 years old.
91. They got new teeth.
Yep.
Supported by implants.
Yep.
Why would a 91-year-old want to do this?
Because he's a public speaker. He goes all over the world to speak. He's a speaker for German culture. Okay. So he goes to like different parts of the world. He promote German cultures, and he need new sets of teeth so that when he speak, he doesn't need to worry about the dentures falling off. He doesn't want to embarrass himself in the middle of the conversations or during the middle of the presentations. He wants something that when he go to do his job, he is comfortable doing it.
Okay.
So, and on top of it, after the meeting, he has to eat. He doesn't want to worry about what he eats. We're having new sets of teeth that stay in his mouth. I mean, he basically eat whatever he wants. He wants steak, corn on the cob, bite off an apple. I mean, anything you can think of.
So he would have had a denture.
He would have a dentures. I mean, if he didn't come to us, most likely he would end up to have a dentures, top and bottom. And guess what? Most likely he'll be so embarrassed speaking in front of a large audience, and he will become more introvert. He will be shying away from speaking. He will be afraid meeting people for dinner because he's afraid that the teeth come out and all this stuff. So I think it's great that he came to us so we can deliver the service or the care that we provide to him.
Okay. What about the people that have bad gums, gum disease? Can they do it? Or are their gums too bad to hold the implants?
Of course they can have it done. And I would say majority of my patients are patients who have severe periodontal disease, gum disease. Okay. So what we do is that during the surgery, not only we take out all the bad teeth, but we also clean up all the infections around the gum, clean up all the junk around that area so that we can make the gum tissues nice and healthy for the implant. It's basically a reset button for patients' oral health.
A reset. How soon can they eat if everything goes right after the procedure?
They can eat right away, but we always recommend the patient that for the first couple months, stay on a soft diet so that because you want to kind of give the time for the implant and the bone kind of like, blend in together. And then before you know it, they already eat whatever they want.
So they could have like a steak. What about nuts? Can they eat nuts?
They can eat nuts. You know what's the things that they like the most?
What?
Bite off an apple. It's amazing that I have so many patients, when they came in to get their final teeth, but you know what they bring with them?
What?
An apple. Because I asked them, when was the last time they have done it? They said, decades. 10, 15 years. They said they have never bite off apple for the past 10, 15 years because they couldn't. They couldn't with their teeth that they have.
So you hear a lot of eating stories when it's all done, like what they're eating?
I mean, it's amazing. I mean, sometimes it's amazing in a way is that the story they tell us is the things that Randy, you and I do every day. It's like, biting off an apple, eating corn on the cob. I don't have to worry about it. You don't have to worry about it. It's like, why those people have to worry about it? And that is the goal of our practice, is to make them not feeling worried about what they eat.
Okay, now you brought some photos.
Yes.
You say this is life-changing for these people.
I mean, definitely. I mean, when they get the new sets of teeth, you can look at the aura, the energy that they have. It's not just the teeth, but also their personality. It brings out their personality out there. I mean, like when they first come to see me, they be like, they're shy, they're introvert, they don't want to smile. After they get their teeth, especially when they come back to see me in that 2 weeks, 3 weeks follow-up, it's like a totally different person. They smile, they talk.
You say sometimes you don't even recognize them. Like, is that like because they're
because they all went to get a haircut, they have new clothes on. I was like, what happened to that past 10, 15 years that you don't get a haircut for the past 10, 15 years? I mean, I would say the smile bring the positive side out of you. And then because the smiles that they didn't like, because of the moving teeth, the dentures, they're depressed. They always have this sad face. They feel like for whatever they do, it's just like it's not better because they always have these smiles that they are not comfortable with.
Now you say this procedure, you take somebody with no teeth or really bad teeth and give them a brand new set of teeth. You say it changes their lives.
I mean, Randy, I didn't say it. They told me about this.
Okay.
I mean, like some of those before and afters of the surgery. I mean,
let's take a look. You brought them.
Yeah, definitely. So this is Bill right here.
Okay.
He came to see me. Very typical story. Hardworking guys, take care of everyone in the family, except himself. And then once he have time for himself, he want to get himself taken care of. But guess what? He has one of the biggest fear to seeing dentists. He gag. Anything that put in his mouth, you put fingers in his mouth,
he gags.
He gags. He just can't go see a dentist because no dentist can work inside his mouth. And then after all this year of neglect, the teeth become mobile because they start to move, the gums start to bleed, and then when he bites, he hurts. It's just that it becomes more and more depressing for him.
Okay.
So he referred to us, and then he was like, gosh, I need help because the last time I went to see a dentist, the guy told me that I need to wear dentures. But I can't wear dentures because I gag.
Okay.
So he referred to me, and I told him that, no worry, we can get you taken care of. But he said, Doc, I don't know how to take the gooey stuff you put in my mouth. I couldn't tolerate that. I said, don't worry, the way how our office works, we don't put any gooey stuff in your mouth at all.
That impression material, the goo, you don't use.
We do not use it.
What do you do?
We use a little camera, we put in the patient's mouth, and then we scan it. The camera is going to take pictures of the teeth, the gum tissues, so that we can send it to our lab to design the teeth. So in this whole process, no gooey stuff, nothing's like coming in and out. Everything is digital, seamlessly working for the patients. So he came in the day of surgery, we put him to sleep, we take out all the teeth. He woke up, he didn't feel anything. We do our workup. He go home, come back later on in the afternoon, he gets brand new sets of teeth.
In the same day?
On the same day, boom, like that.
So this is him right here. He looks pretty happy, looks pretty good.
I mean, his amazingly happy with what the result is. He's amazingly surprised at how smooth it is, because the biggest fear he has is gagging. When we work on him, he'll ever gag because we don't put any gluey stuff in there. Everything's just work out very nicely for this
Is
patient.
this one of those things where they say, I should have done this years ago. Why didn't I do it earlier?
Definitely. I mean, the problem is, go back to what we said earlier. Sometimes the patients just don't know. They don't know
their
options are. But now they know. They come to me and we get them taken care of. Second patient.
Okay.
Right here. This is Richard. Richard has an amazing story. Richard has a younger wife, but he is very embarrassed to go dinner with her. His wife is younger, beautiful teeth, very sociable. Him, on the other hand, years goes by, his teeth start falling off. He start to have gaps here and there. Teeth start to bleed, and then the teeth start to move. So he's embarrassed to go out dinner with his wife.
Okay.
And then he referred to me again, and then he's like, "Hey doc, you know what? I need to have a better smile because I felt like I'm disappointing my wife because I cannot go out with her because she looks young, she has a beautiful smile. Me, I'm just like an old dude sitting in the back, and I couldn't smile because when I smile, I have all this gap in my teeth right there." And
so these teeth you could not save; they had to be removed.
They could not be removed.
And he was referred to you because he didn't want a denture. Is that right?
He was referred to me because someone told him that he doesn't have enough bone for the implants.
Okay.
And then the dentist who saw him said, "You have to see this guy. This guy's
He's talking about you.
That's me." He said, "This guy will take care of you." So I saw him. I told Rich, "No worry, we'll get you taken care of." We do a consultations. We do our workup. He come back. We do the surgery. Sedated, extremely comfortable. We do the scan afterward. Make the teeth custom to him.
Okay.
He come back later on that afternoon, and then we give him a brand new set of teeth. Boom, like that.
Walks out with teeth in the same day.
Walk out the teeth the same day. I mean, Randy, look at the before and after. Look at the before pictures. You can see all those teeth are not in not in good shape. And then look at the after. This is literally happening within 24 hours right here. That's how we transform his teeth. I mean, he start to smile more just within 24 hours. Just imagine, he start to smile more. He can eat more. I mean, he has so much more energy. And you know what he does? The first things, he goes show his wife that how good of a smile he has.
You say that some of your patients, and you were telling at the break, that they send you pictures of them eating something.
Yes. And we have one right here. He went to a restaurant with his wife. It's like the first time for many, many years that he'll go out with his wife and enjoy a nice meal. I mean, like something that you and I do on a daily basis.
Yeah,
we take for granted. But for patients like him, and for many of my patients, it's something that they just want to have. Is that something that they are not worried about eating. They're able to smile, and they can enjoy life with their spouse and their family.
Now, something you mentioned about bone earlier with this particular person was told they didn't have enough bone. But isn't it true if you've been wearing a denture for like 10 or 15 years, you don't have enough bone to get a new set of teeth supported by dental implants?
I mean, not the case anymore. With the technology we have, the skill sets that most of oral surgeons have, we have different type of implants, different type of bone regenerative material. Most of the patients who come to us, they may not have bone, but we were able to rebuild it, and then so that they have enough bone to support the implant and the teeth.
So when it's all done, what do they like more? Do they like what they can eat, or do they like the way it looks?
I mean, some of them come in to see me because the only thing they care about is just they want to function, they want to eat what they want. Some other people come in to see me because they want a big smile. But at the end, guess what happened? They like it both. They want to smile and they want to eat. And guess what? That's what we like about our teeth. We like to smile and we like to eat. Okay. And that's what we are giving to them.
So can your teeth ever be too far gone? Or your gums be too far gone to do this?
No, I mean, absolutely. Like I said, we have different ways to approach this so that we will take care of all those diseased gum. We will clean it up so that when you have a new implant, new set of teeth, it's the third set of teeth you have. Like just imagine when you were young, you have a baby teeth, and then when you are a little bit older, you have your adult teeth. Right now, what we are giving the patient is the third set of teeth.
To get their teeth back.
Exactly.
Good, good. Time for a few more photos.
Sure. So this is amazing. This is Shelly.
Okay.
Shelly came to see us. She's a nurse. She takes care of everyone else except herself. And, you know, they work hard. They work overnight shift. They take care of patients in the hospitals. And as a matter of fact, she came to see me. She came to see me with her friend. I also have it right here.
Okay.
Together. And that's Shannon. They both came to see me. Same problem. Teeth are not in good shape. Teeth are moving. They have a lot of cavity there. Gum is bleeding. And they feel so uncomfortable.
And they don't want dentures.
And they feel embarrassed to have a denture because they're nurses. They want to see their patients, so they don't want the denture to fall out in the middle of a conversation. So they came to see us and said, "Doc, like, what can I do to do this?" The problem is I cannot miss work because I have patients that we need to take care of. So I told them that, don't worry, come to see us. We take out the teeth, we clean up all the infected gum disease, all the infections in there. We give them the implant. And then we turn around. Within 24 hours, boom, new set of teeth. They go back to work in 3 or 4 days.
It's very nice. When I look at the before and after, side by side, it's very nice.
Look at the second photo. Shannon, who came to see me, she barely smiled. You can see that she had that hesitant of smiling.
Even in the after photo.
But after surgery, after the photos, you can see her smile kind of getting bigger. But guess what? She's going to want to show more as time goes by. When I saw her a couple months ago for her 3 months follow-up, she smiles so big that I feel like I have to give her a bigger set of teeth.
Okay. Now, people with bad teeth, and we've talked about this, they are judged. What are your thoughts on that?
Absolutely. I mean, to some extent, it's probably both ways. People judge them, and they also judge themselves. Because they feel like they look at the mirror every day. Because every day when we wake up, we go to a bathroom, we look at the mirror, we look at ourselves. We want to, when we smile, when you see all these bad teeth, all this like cavity, black, brown, bleeding gum, you feel bad. Just imagine every day you wake up, you see yourself with bleeding gum and brown and black teeth. Like, how good of a day can it be for you?
Okay.
So they judge themselves. And then they are self-conscious when they talk to people. So even though some people may not be judging them, they feel like they're being judged.
Okay, that's what they tell you.
That's what they told us.
You know, we were talking about this like in the movies, in Hollywood. If you want to make somebody look poor, you give them bad teeth. Yeah. I even know dentists that make bad teeth for the movies to snap on over an actor's teeth. So we do associate, you know, maybe somebody that's not clean or whatever with bad teeth. But that could all be turned around, you say.
Easily, like I said, that's what we do, and I'm excited to tell when I see my patients the first time, because I know it when I see it, I was like, oh my God, I cannot wait to do her surgery.
So if somebody's watching this show, next week they get a brand new set of teeth.
They will get,
or even in 2 days from now, they could have a brand new set of teeth.
They come to see me, I talk to them, walk them through the process, introduce them to my team, and then we'll do the surgery next day, and then within 24 hours, boom, they're gonna have a brand new set of teeth.
Now, I know you have a few more photos, so I'm going to rush you through these because we got about a minute and a half left.
So next one.
Okay.
Chuck. Guess what? Like I said, Randy, all walks of life. Chuck is an executive in a Forbes 500 company.
Okay.
He came to see us, has missing teeth, went to see dentists all his life, bridge started falling off, and he just cannot go to a meeting without dentures.
Okay.
So he come to see me. Boom, same thing. He comes in, we do the workup, do the surgery. Next day, he gets his brand new set of teeth. That is Chuck right there.
Very nice.
Next one. Same thing. There, Doll's gonna get married soon. He wants to look good on the pictures. Only dollars he has, so he wants to look good on the pictures. But guess what? Wedding's down the road. And he can't tolerate dentures. So he came to us, and then I said, no worry, we'll make it happen. And same thing, we take all the teeth, clean up all the infections he has, give him a brand new set of teeth within 24 hours.
He seems like a young guy to be wearing a denture. Like he could have been wearing a denture.
I mean, he looks young. Actually, he's in his 50s already.
He looks good.
Yep. So, but that's what we do. This guy, great story. I love this guy. This guy had problem with medications that damage all his teeth, and he's a young kid. He doesn't want to walk around with his kids with teeth like that. So I told him, don't worry, come to see us, do the surgery, clean up all the infections, go home, come back next day, boom, brand new set of teeth. He can ever be happier.
Very nice.
Next one, same story.
Oh my goodness.
A lawyer. The story with her is that she had bariatric surgery done. She lost a lot of weight, a lot of deficiency in vitamin, lost her teeth. Same thing, coming to see us, take out the teeth, clean up all the infections, get a brand new set of teeth. Perfect. And like I said, I have lawyers, we have executives from a big company, nurses, blue collar workers. Everyone can have this kind of problem.
Okay.
Same one, next one, person retired.
Again, and these are all people that probably would have been in dentures.
That's right, because they have no better options. They do not know better. Another one, right
so
here.
Same thing. This guy goes from this
Yep,
and a brand new set of teeth.
24 hours.
Okay. Okay.
Same thing, next one right here. Brand new sets of teeth, 24 hours. This is a very nice lady in her 80s.
Okay.
She come into my office with a little walker, and she told me, Doc, you know what? I can't walk, I can't eat. What's the point of life? Can you give me a brand new set of teeth so I can at least enjoy like my life like I used to? No problem. Come in, do a consult, work her up, do the surgery, boom, next day, she got brand new set of teeth.
You say 24-hour turnaround.
Yep.
Is that an exaggeration?
Nope, it's not. It's 24 hours.
It's because your lab is right there as well.
My lab is here.
You have like digital printers that make teeth.
That's right.
Is that right?
And when we design teeth, we use a computer to design teeth. If you come to see us, you say, hey doc, you know what? I wish this teeth can be a little bit longer. I don't have to go back to the lab and shave down the teeth, all this stuff. We just design it on the computer, and then we turn it around and get them a brand new set of teeth. Like
Good
that.
for you. We are out of time. So no more dentures.
No more dentures.
You think in North Carolina you could wipe out all the dentures?
Not immediately, but hopefully in my lifetime.
Over time. Look, I want to thank you for coming on the program. If somebody is watching this, and maybe they're of the two categories, they have really bad teeth, bleeding gums, bad breath, loose teeth, they're headed for a denture, or the denture wears. Let's say they've heard what you had to say, but for whatever reason, they're going to put it off, or they're skeptical. What do you say to them?
I would say, give us a chance, because we can make your life much better in 24 hours.
Okay, good. I want to thank you for coming on the show. Great stuff.
Thank you, Randy.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Hours. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.